Miss Swenson, my first patient's been prescribed an NG tube to relieve her nausea and vomiting while we treat her paralytic ileus.
Does the patient know the reason for the tube?
Yeah, her doctor explained it to her and she's agreed to have it.
Well, why don't you gather your supplies and I'll meet you there, okay? You'll do just fine.
Thanks. Hi, Mrs. Potter.
Hi.
This is Miss Swenson, my instructor. She's going to be working with me this morning. Is that all right?
Yeah, that's fine.
Okay. Now, I know the doctor talked to you about the tube for your stomach. I'd like to put it in.
Okay.
Once it's in place, you won't feel so nauseous, and you won't vomit.
Are you sure it's not gonna hurt?
It might be a little bit uncomfortable going in, but I understand that it's not painful. Your throat might feel a little bit sore afterwards, but we can get the doctor to order some spray to help with that.
Okay, let's do it.
Okay, I'm just going to check your ID band. Can you tell me your full name, please?
Catherine Potter.
Okay. Now I'm going to need to assess your abdomen. I'll lie you flat and lift your gown. Is that okay?
Mm-hmm.
Okay. Now I'm just going to sit you all the way up.
Okay. Jeannie, be sure to have an emesis basin and tissues within reach during the procedure, okay?
Okay. Okay, what I'm going to need you to do is close one nostril and then the other. Tell me which one it's easier to breathe out of.
This one?
Okay, that'll be the one that we're going to use.
Okay.
I'm going to cover you with this waterproof pad. You can keep that basin handy right there.
Okay.
Okay, I'm going to measure to see how much tubing we need. Go from the nose to the earlobe, and then down to the,
Xiphoid process.
Thank you. Okay, I'll mark that with a piece of tape. Okay. I'm going to open this up. I'm going to put my gloves on. Now I'll just lubricate the tip of the tube about 1 to 2 inches with water-soluble lubricant.
Good, Jeannie.
Okay. Just lift your head. Here we go. Okay. Just put your chin to your chest and swallow the water. It'll help pass it down.
Oh. Very good. Now keep advancing the tube. Be sure to pause when the patient breathes. And don't force the tube, okay, Jeannie?
Okay. Okay, we're at the tape marking. Now I'll just check. You can relax. I'll just check to make sure that it's in the stomach.
I'll hold that.
Thank you. I'm going to aspirate a small amount of stomach contents.
What are you looking for, Jeannie?
Well, I'm assessing color and consistency. Gastric fluid can be green with particles, brown if old blood is present, or clear to straw-colored. This looks normal.
What other ways can you check if the tube is in the stomach, Jeannie? There are 2 other ways to check. You can measure the pH of aspirated fluid using the pH paper or a meter. Now, stomach contents have a range of 0 to 4. The other way is to obtain a radiograph or X-ray to confirm placement. A physician's order is required to obtain this film.
Okay, I'm going to take this tape off here. Not hurting you, am I?
Oh, it's okay. Okay.
Thank you, Miss Swenson.
Sure.
Now, this is going to be a little bit cold. I'm just going to apply something to your nose to protect it from the tape. All right, I'll let that dry.
Okay. Oh, good. Be sure not to pull the tube too tightly against the nose, Jeannie.
There we go. Thank you.
Mm-hmm. Okay. Now you'll want to measure the tube from the tip of the nose to the end of the tube. This measurement will help determine proper placement later, Jeannie.
Okay, looks like 24 inches. Now I'll just secure the tube to the gown using a rubber band and safety pin. I'll be sure to put the air vent above the level of the stomach. Okay.
Okay, let's attach her to the suction, Jeannie.
All right, Mrs. Potter, you did great.
Oh, what a relief. Wasn't so bad. It was uncomfortable and unpleasant, but just for a short time.
Well, I'm glad to hear it wasn't too bad. I'm going to help Mrs. Potter with oral hygiene now.
Okay. Very nice job, Jeannie. Now, when you document the procedure, you have to include a couple of things. The type and size of tube used, the nair used for insertion, the measurement of the exposed tube, the characteristics of the drainage in the tube, and the patient's response to the procedure.
No problem.
Okay? Thank you, Mrs. Potter.
Thank you.
Is it okay if I brush, or would you rather do it yourself?
I can do it.
Okay.